As you know, chiropractic is a science, philosophy, and art. And bridging the gap between the three is no easy process. Early on, I recognized that our profession needed leadership that could transcend research into practice. Sure, we have great researchers in our profession, but they're very academic usually and are not very visible to the mainstream chiropractor. On the other end of the spectrum, we have incredible motivational speakers, chiropractic philosophers, and practice management consultants that are very visible to the profession, but have very little in the way of science and research validation. By the same token, our profession has a history of technique gurus have come up with their own method of finding the subluxation and adjusting it. Some of these methods seem very straightforward and logical, while others seem pretty far-fetched to me. I'm Dr. Chris Koloka, and I'd like to tell you about the neuromechanical system. Our team has developed a new style of chiropractic analysis and adjusting procedures that incorporates the best evidence from research together with practical clinical protocols geared toward helping you find the patient's problem and effectively managing it. The neuromechanical system is derived from our current knowledge of neurology and biomechanics and how these disciplines blend together to provide the state-of-the-art in understanding the mechanisms in which our patients become dysfunctional and symptomatic. The technique application of the neuromechanical system is very straightforward. We're going to teach you how to find the areas to be adjusted and the instrument adjusting protocols that we recommend to make adjustments. Simply stated, we'll incorporate elements from the patient's history, physical exam, and your other clinical findings on each visit to determine the areas to be adjusted. This incorporates very logical approaches to determine the problem area, including palpation, range of motion, muscle strength, and posture that you can incorporate quickly and easily into your existing practice. You'll learn the appropriate segmental contact points, vectors or lines of drive, and combination adjustments. This is adjusting joints and muscles together in combination to optimize results. Our goals, of course, are to reduce pain and improve function. But we also want to ensure that we've addressed the muscular components of the patient's problem to prevent recurrence. Sometimes we'll recommend you adjust directly over a joint, and other times at the origin and insertion of a muscle, and in this fashion to achieve the outcomes that we're looking for. We'll even teach you rehabilitation techniques to strengthen and stabilize dysfunctional areas. So what is the neuromechanical system? It's a system of chiropractic technique, patient, and practice management, featuring chiropractic instrument adjusting with the Impulse family of adjusting instruments. So join us at one of our seminars. You'll get first-class instruction with our faculty of instructors and plenty of time for hands-on experience. So you'll be ready to use our technique and adjusting instruments right away on Monday morning when you return to your office. From a patient management standpoint, we'll offer you suggestions for care plan development and practice management. We'll give you business sense, so you'll go away from the seminar energized and refreshed. You'll even receive 12 hours of continuing education for license renewal for your attendance. Check with our office if you have any questions about requirements for your particular state. Join us at a city near you and get away for a weekend and recharge with us. You'll be glad you did.